Hi, everyone. Thank you for joining us for today's QC COVID-19 press briefing. It is Thursday, July 23rd. Today with us, we have Janet Hill, Operating Officer at the Rock Island County Health Department, Ed Rivers, Director of the Scott County Health Department, and joining us, we also have Dr. Cheryl True, who's a family and lifestyle medicine physician, as well as the Medical Director of the Rock Island County Health Department. So today, each of our panelists will have prepared statements that they will provide to you, and then we will go to the chat and answer any of the questions that you may have. We encourage you to put those in there at any point, and we will get to them in the order that they are received. But we'll go ahead and start with Janet. Can you provide us the numbers for Rock Island County for today, as well as your statement?
Hi, everyone. We have 30 cases reported today for a total of 1,429. We have 18 people hospitalized. Our deaths stand at 30. Today, I also wanted to talk to you about proper mask wearing. I don't get out and about often, but when I do see a lot of people wearing their masks inappropriately. So I wanted to just do a brief tutorial on what you should be doing when you're wearing your mask. First of all, it's really important that you have clean hands before you start. So you should either use hand sanitizer or wash your hands before you go. And then after you do that, it's important to touch them only by the ear straps or the ties, and then to put it over your nose and your mouth, around your ears, and then after that, secure it under your chin. You try to make it fit as snugly as possible against the side of your face, and still make sure that you can breathe easily. It's important not to put the face covering around your neck or up on your forehead. That's not doing anyone any good. Remember that my mask protects you and your mask protects me. While your mask is on, we ask that you do not touch it, and if you do, you need to use hand sanitizer again or to wash your hands if that's possible. When it's time to stretch the ear loops and handle it only by the ear loops or the ties, and then after that you fold it carefully so the inside corners touch, and then you should wash it because you need to keep it clean, and you should wash it every other day or so. This should not take the place of the other healthy tips that we've been talking about. While you're wearing your mask, you still should stay at least 6 feet from others. You still should avoid contact with people who are sick. You still should wash your hands often with soap and water for at least 20 seconds each time. That's roughly the time of singing Happy Birthday twice or singing the alphabet song. And then it's really important to use hand sanitizer or soap and water and out of it. That's all I have. Thank you.
Thank you, Janet. Next, we'll hear from Ed Rivers. Please go ahead, Ed.
In Scott County today, our total number of cases are at 1,389. Our deaths remain at 11. In addition, today we announced that the Iowa Masonic Care Facility, in coordination with the Scott County Health Department and the Iowa Department of Public Health, have identified a total of 14 cases of COVID-19 in residents and staff at their long-term care facility in Scott County. According to the Iowa Department of Public Health, an outbreak occurs when there are 3 or more cases of COVID-19 identified among residents of a facility. No deaths are associated with this outbreak at this time. The facility has notified residents and their families, and consistent with the IDPH guidelines, the affected residents are in isolation. Iowa Masonic staff are working closely with Scott County Health Department to protect the health of all residents and staff. Now, COVID-19 spreads easily and rapidly in settings where people live close together. Older adults and those with underlying chronic medical conditions are at increased risk of severe complications due to COVID-19 infection. As we've been stressing, the additional cases of COVID-19 in our community increase the risk of virus spreading to members of our community who are at most at risk. Everyone should wash their hands often Practice physical distancing by maintaining 6 feet between yourself and others, and wear a cloth face covering when physical distancing is not possible, and stay at home when you're sick.
Thank you, Ed. Next, we will hear from Dr. Cheryl Teo. Please go ahead, Cheryl. Thank you.
Hi, thank you for having me today. Kind of prefacing this with an event that happens in the Quad Cities every couple of years. Every 3 years, and as a matter of fact, we do our community health assessment. We get a snapshot of the health of the Quad Cities. We last did this in 2018. Our next one is coming up in 2021. And when the SARS-CoV-2 virus that causes COVID was first starting to circulate, the demographics of those who were more severely affected with this disease were starting to be recognized. And given those demographics, I was kind of worried about what would happen in our community. The first emerging risk factors were things like older age, high blood pressure, diabetes, heart disease. And as the world experienced more cases, other risk factors were added to this, such as obesity, chronic kidney disease, COPD, immunocompromised states, and sickle cell disease. And at the beginning of all of this, we also heard that cautionary timeline, 12 to 18 months of vigilance, that we would be continuously expanding our knowledge about this novel virus, discovering effective treatments, developing a vaccine. But first, we really had to get through those first early months where there was a lot of stress, a lot of confusion, a lot of fear. Our messages about protecting yourselves and others have remained the same. Practice good hand hygiene, stay home if you're sick, physical distancing of 6 feet or more, avoid those large gatherings, and then the addition of wearing a face covering. And those have been kind of our standard message. And it's now July, we're 8 months into this global pandemic, and we know a lot more about this virus. We know a lot more about the effects it can have on the human body, and we've had a small glimpse of maybe some of the lingering consequences. We don't know the long-term outcome yet, and we won't for many years, and only time will tell kind of what this virus has in store for us. So our standard messaging is out there, and we know it's being heard. We know people are practicing many of these things, and I'd like to maybe add a perspective of some approaches that we can use in the months ahead. So the chronic conditions that increase risk for severe COVID symptoms are very present in our community and in our country. And some would say we have an epidemic of those things: diabetes, heart disease, high blood pressure, obesity, high cholesterol. We know that the root causes of those chronic diseases can be very similar too, and they're often fueled by our lifestyle choices. Things like what we eat, how active we are, the substances we may choose to use, such as nicotine, alcohol, or drugs, how we sleep, how we manage our stress, and how we relate to each other. And in terms of lifestyle choices, there's very strong evidence that there are 4 major factors that can actually make a big difference in preventing and managing those chronic conditions that came out of a 2009 study. 1 is don't smoke. 2, maintain or achieve a body mass index of less than 30. 3, eat a healthy diet. And 4, be physically active. And it sounds like 4 very kind of common sense things, but these can actually be very powerful tools for us as we look ahead. So in addition to our current precautions that we're already taking, what else can we do to reduce our risks during the pandemic? Obviously, we can't change our age, but we can change our choices and possibly reduce our risk of having some of those chronic conditions. As a side benefit, if we take some action there, we may not only reduce our risk of experiencing severe disease if we do get COVID, but we get that side benefit of maybe reducing our risk for other things too, like our top killer, heart disease, diabetes, high blood pressure, chronic kidney disease. So we can look at some of this as self-care, but we can also maybe extend this into our families and our communities going forward. So these health-promoting habits are also things that are helpful across the lifespan. We can apply this to children, we can apply this to older adults, and we can find ways to maybe adjust and adopt some healthier choices going forward. And just as a note, lifestyle change can be a very powerful tool. If you're on chronic medications or you have some of these chronic diseases, you're under the care of a healthcare professional, and you want to make changes in your lifestyle, please check in. Some of these changes can be so powerful that you may need to have some of your medications altered as your health conditions improve. And one other point to make is that the things that are good for our physical health are often very good for our mental and emotional well-being as well. So let's One, if you use tobacco products, please quit. Do this on your own or with assistance of over-the-counter products or even tobacco cessation programs. Number two, be more active. And I think the Quad Cities may be embracing this one already. I've seen many of you out there on our wonderful trail systems. So kudos to those who have gotten out, gotten that new bike or put on those new shoes. Those things are very good for your overall health. And you don't have to become a runner to benefit from being more active. Being active can be related to those planned exercises, but they can also include routine activities that you can do at home. You can go for short walks several times per day. You can take the kids out to play Frisbee. You can walk your dog. You can do stairs up and down in your house. You can use common household items to lift weights. Getting outside can actually be a really good thing if you can do your exercise safely out there. Getting the sunshine and fresh air can be good. We can get a little vitamin D with our sun exposure. So looking for 30 minutes a day, 5 days a week or so, can be a boost to both our physical and our mental well-being. And number three are dietary choices. And this is an area that can actually make a very dramatic impact. While we've been eating at home more, I think people have been experimenting with new recipes, find new ways to do things that maybe change it up to keep it from being boring. But if we look at ways to introduce more whole foods, foods as grown, we can actually gather some more health benefits from some of those experiments. Adding fruits, vegetables, leafy greens, whole grains, beans, legumes, nuts, and seeds into our diet really play a major role in our health. And we often don't get enough of those if we're eating kind of a standard American diet. And those big three diseases, diabetes, high blood pressure, and heart disease, really can see major benefits if we can add some of those whole foods into our diet. So these foods are very rich in things like phytonutrients and fiber, and these are important for our general health and work a lot through our gut flora, our microbiome. By paying more attention to adding these healthy items, we can really give some dramatic benefits to our health conditions. And this doesn't have to break your budget either. There are ways that you can even reduce your food costs while you're eating healthier. Adding in fruits and vegetables is actually really easy at this time of year, depending on where you live. And we are fortunate to have things like a wonderful farmer's market and some roadside stands. And if you live in Iowa, you can use your SNAP bucks in the Double Up program and give even more for your money. You can also look at canned and frozen produce. If you don't have access to fresh, these might be a little bit more convenient and shelf-stable for you to have at home. We can also see that the health conditions can respond very quickly to just adding in these items a little bit at a time or very dramatically by doing kind of a major overhaul all at once. But some of the main things that we might see are reductions in our blood sugars and our blood pressures. And one maybe added tip is to add herbs and spices to flavor your food. These can add their own individual health benefits and may help you reduce things like your sodium intake and reduce your needs for the salt shaker. So these are just a few tips to kind of get you started thinking about maybe a longer-term approach while we're still in this pandemic time. There are very many local and online resources that can help you achieve these changes. And if it seems overwhelming that there's just too many things that you'd have to do, it's okay to just start by picking one. Maybe you really like to get outside. Maybe you really like to walk. Start with a 5-minute walk at lunchtime. Or maybe you'd like to see some changes in your diet. Add one piece of fruit at breakfast and a new vegetable every day at lunch. Some of the best parts is that you can have so many abundant choices and that you can see some benefits from these changes pretty quickly. And that often is a very good encouragement to continue doing them or even to add some more. So be safe, be well, and I'll see you either in the produce section or out on the trails.
Thank you so much, Dr. True, for sharing that great information as we continue to have individuals in our community dealing with COVID or preparing to protect themselves from it. We really appreciate all of that information that you shared. Prior to the call, we did get 2 questions that were for you that we can share with you. And I know you touched on some of it. Perhaps it gives you just a chance to reiterate some of that. What role does mental health play in changing habits? And then what steps can individuals take? I know you said start small. So if there's anything else you'd like to share with that, please do.
Yeah, I think in town we have so many great resources, and I've been privileged to be a part of the Quad City Behavioral Health Coalition, and to hear some of the struggles that the citizens in the Quad Cities have had, and the fact that people are reaching out. For some people, this may be as easy as they just need some accountability. They need a partner to maybe help them stay accountable to themselves. Maybe you have a buddy that you're going to meet every day for a walk, or you're sharing recipes with a friend to really help you get going. If your mental health conditions are really preventing you from moving forward, it may be worth seeking professional care so that you can help overcome some of those barriers and challenges. It can be very challenging if somebody is suffering from depression to push themselves forward, and they may need some professional help to get past some of those hurdles. But people often find that they may just not have the confidence to move forward in some of these, and to have successes in one area really helps them build that self-efficacy to bump them up to be able to do the next one. Health coaches can be very helpful. Personal trainers can be other areas, or even just having a neighborhood group that meets every night for a walk can be something that really boosts somebody's encouragement to go do some of these things.
Thank you. And then the second question was, do you have recommendations for individuals with disabilities and for parents with children who have disabilities and special needs?
That's an interesting question, and I'm part of an organization called the American College of Lifestyle Medicine, and we have some occupational therapists that participate in that organization, and I've been so impressed at the information that they've brought forth about how we often ask people to make changes, but we don't always help maybe devise ways to compensate for something that somebody may not be able to do in the fashion that I could do it. So organizations in town that may be very helpful for local resources would be places like Hand in Hand, Jim's Place through St. Ambrose could look at what built environment changes you could make in your household that would make some of these changes easier. The Children's Therapy Center, Genesis or Trinity's pediatric OT and PT departments for the kids, Handicap Development Center, CASI, are the ones that kind of came to mind kind of off the top of my head. And if others know of other resources, it would be great to kind of get that list together. We know of a lot of resources for our mental health, and I know Quad City Health Initiative has some new resources coming for some other aspects of like the initiative that will give us more resources as a handout. But those are some that come to mind for some of the people that were in that question.
Thank you so much. We did have a couple of additional questions that popped up, most likely for Ed in the chat. He has answered some of those. Janet, I'll also give you a chance. Can you describe the tracking of infections in care facilities in Rock Island County and how that takes place?
Sure. The Illinois Department of Public Health has been tracking outbreaks at all long-term care facilities and has been updating their website very frequently. I just put in the chat the status of Rock Island County. And we had outbreaks pretty early in the pandemic, and we're talking about this several months ago. It has leveled off quite a bit. We have not been tracking, or we have not been hearing about outbreaks in a while. That's partially because nursing homes finally got access to the PPE that they need. But you can always go in and check the record. Any county in Illinois is updated on that website, and you can specifically go down to Rock Island.
Okay, we have another question, and we'll probably go to Ed first on this one. Most of us in the general public thought that this pandemic was going to be over, or at least slowing down during the summer. This recent uptick is proving that isn't necessarily the case. Do you still think that the public is not taking it as seriously because of the warm weather and being outside more often?
Well, we certainly hope that people will employ the methods that we've talked about at length. Those are the only things that can protect us from this virus. Social distancing, wearing a face covering in public, staying 6 feet from others when possible. There's not yet a vaccine. There are no therapeutics that have been proven effective in any great measure so far. So it's that personal responsibility we talk about. Obviously, people are going out, becoming exposed to it and passing on to others. The average age before mid-June was between 45 and 50. When the spike began, that average age dropped to about age 30. It has since risen to about just over 41. So we're likely seeing secondary infections from the younger people becoming infected and passing it on to perhaps their families or places where they work to older individuals. This Iowa Masonic outbreak indicates that it is still active in our community, and unfortunately it's infecting those who are most at risk. So we would urge everyone to take it seriously and employ the methods that we've reiterated to you time and time again that are proven to work against the virus.
Janet, would you like to add anything to that in terms of your thoughts?
I would say that, we all may be tired of the virus, but it's not going anywhere. And that, taking your precautions is an act of kindness. Love in your entire community. And I just think it's important to understand that actions that we take have a direct impact.
Thank you. And we have a request for a photo of Dr. Truth. We will work on getting that to you, WVIK. And it doesn't look like we have additional questions, so we'll take a moment to thank Dr. True for being on today, as well as Janet and Ed for sharing important information. We do look to send you additional information, so we'll be looking at that through your email, but we will conclude for today. Thank you for being on. Have a good afternoon and enjoy your weekend.